computer. Right. Hello, and welcome to the poster presentation on Virtual Pediatric Symposiums. I'm Brittney Nichols, EMSC Program Coordinator from Kansas.
And I'm Vicki Petersen, EMSC Program Coordinator from Iowa. We're here representing our Heartland EMS for Children Coalition, which also includes Corolla Lauck from South Dakota, Debbie Kuhn from Nebraska, Kjelsey Polzin from Minnesota, and Samantha Harrison from North Dakota.
Heartland EMS for Children Coalition is hereafter known as HEC.
HEC was formed prior to the pandemic to share resources and advance some of our EMSC goals as a group because we know we're better together.
We had begun talking about finding a way to provide continuing education to medical providers in early 2020, but you all know what happened then, a global pandemic. And then providing quality continuing education became even more important and more complicated.
Because while the lives of every medical provider and every EMSC manager were altered by COVID response, providers still needed pediatric education, and we needed to continue to advance our EMSC goals.
So meeting virtually, we began to talk about how to accomplish this and came up with the idea of providing virtual training. We knew it had to be cost-effective, free for students if possible. We wanted to make it available to the widest possible audience. And of course, it had to fit the constraints of isolation.
Now, let me tell you right here, not a one of us is a technical genius, although Sam certainly comes the closest. And it goes without saying we didn't have much money, so we had to do a lot of research.
Finding a platform from the training was maybe the biggest challenge. At first, we tried some pretty labor-intensive approaches for registration and attendance tracking, and we had the good problem of having to turn away viewers because our platform didn't provide enough space. We eventually ended up using Zoom for Webinar, which allows 5,000 attendees and handles registration and viewership reporting for you. It even provides spreadsheet data that can be sorted by state, but first we had to learn how to use it.
I have to say the technology part probably gave me the most heartburn. I've been to too many webinars that had sound problems or video problems, and we really didn't want anything to interfere with the message. But we practiced and figured it out, and so far, things have been great.
Another piece that evolved for us was our audience. We wanted to offer the education as broadly as possible and include EMS providers, nurses, physicians, social workers, school nurses, and more. This group has gradually grown to include law enforcement, firefighters, teachers and students, and others with an interest in the topics. We provide EMS CEHs, but wanted to offer other types of continuing education, including nursing and physician credits. Now, if you've ever tried to offer higher level medical credits, you know that can be challenging. Eventually, we formed a partnership with Children's Minnesota, and they now issue those credits by using the Zoom attendance reports.
We do need to insert here that we're in no way endorsing Zoom as better than any other platform provider, just happened to be the one that worked for us.
Another challenge we had was the different approaches to continuing education in each of our 6 states. Because we each distribute our EMS CEHs in different ways, we kind of do our own thing there.
And we were challenged by time since we were all working on some kind of COVID response along with our full-time EMSC jobs.
Now you might be wondering about our costs. Other than our time, our only financial costs are the yearly fee for the Zoom for Webinar subscription and the honorariums we each contribute to the speakers.
One thing we've not had a hard time with so far is coming up with topics and speakers. Our first topic was a really popular 2-evening presentation on human trafficking. Other topics have included children with special healthcare needs, pediatric mental health emergencies, peds and poisons, and a lunch and learn during EMS week on provider resilience.
We continue to work on refining and streamlining the process and coming up with great new topics. Our next scheduled presentation is in October on pediatric burns, and we'd like to do a session on respiratory diseases in children with the rise in RSV already this year. We are thankful to have been able to provide 13+ hours of continuing education since September 2020 to about 5,000 viewers. Most sessions are recorded, so others are able to view them later, although not for credit.
We've learned a lot through this process, and we continue to learn. One of the best parts is seeing how much we can accomplish when we work together. Each of the 6 people in this group brings something different and beneficial to the table. And although our programs are at different stages and our particular constraints are different, what we have in common is greater than what's different about us. We've become a source of encouragement for each other during a time that's been isolating and stressful. We're proud that we took challenging circumstances and pivoted, making something new and beneficial from something difficult.
Whatever this winter and the future holds, we will continue to find new and creative ways to serve our partners. Please know that if we can, you can too. Thank you so much for your time. Please reach out if we can help you.